My name is Dr. Sam Hallibo. I'm a general dentist in San Diego, California. Let's talk about some tips regarding chairside office whitening. We like to use Pola Office Plus in our office for a number of reasons. First one being is that it's a shorter procedure. It usually takes about an hour or less. A lot of other procedures tend to be longer than that, and they'll take up your assistant time. One of the main reasons we like it is that it doesn't require a light. Studies have shown that the result does not change whether you use a light or not with your chairside whitening systems. There's a number of things you should do when you start these procedures. The first one being is take the material out. You should have the bleaching material be room temperature. If your patient hasn't had a cleaning on that day, we typically tell our patients to have a cleaning done before their appointments for chairside whitening. Sometimes we'll see a patient the very next day and we just kind of go in and polish if we need to anything that's around their teeth before we start a procedure. If the patient is having a cleaning that day, we'll remind our hygienist to not use a glycol-based prophy paste. The reason to not use the glycol prophy paste is that it tends to block the penetration of the peroxide during the whitening procedure. Some other tips that we use in our office is we will typically use a quick set stone after our dental assistant has taken the impressions on the patient to make their trays and get them ready while they're having their procedure in the chair. The other thing that you need to know about is that the teeth will continue to whiten for about 48 hours after the procedure is finished. The stain will continue to be removed during that time. We also typically tend to go over post-op instructions with our patients at the very end, and we will give them their trays with potassium nitrate in them to wear out of the office. And we'll also remind them to really keep their teeth hydrated that day, to only drink water and to not drink any liquids that are dark in color. Before we start the procedure, we typically set the patient's expectations. We will typically take a shade on them and take a photo, and then we'll tell them that an in-office procedure will whiten their teeth about 6 to 8 shades for most people. This way you kind of set the tone and let them know going in that they may not be getting the entire 8 shades there that day. One of the things that we'll also do is if they don't get to the shade that we'd like for them to be, we will tell them we're going to be giving them some home bleaching so that they can use it in their tray and whiten their teeth further. In my office, we want to make the patient happy, so we will give them as much bleaching as possible to get them to that shade. Bleaching is not very costly, and a happy patient will refer and tell other people about that procedure. For more tips and information on whitening, go to sdi.com.au.